Welcome, everyone. Glad you are here today. I'm sitting in the suburbs of St. Louis on a rainy day. I hope it's better weather where you are. My name is Rochelle Bartnick. I'm the Senior Community Impact Director for the American Heart Association, covering St. Louis, Missouri, and outstate Missouri. Again, so pleased you're here with us today in our third and final workshop in our Innovations in Hypertension Control series. We are joined today by my colleagues at the National Hypertension Control Initiative with the American Heart Association, and I want to welcome my collaborative partners in developing this series. Again, it was myself with the American Heart Association, my colleague Chris Kummerfeld with the Missouri Department of Health and Senior Services, and Marianne Kimball with the Health Quality Innovation Network. Chris, I know you wanted to offer a few words.
Thank you, Rochelle. And thank you all for being with us today. As Rochelle indicated, this is our third and last of our series on innovations in hypertension control that we started last year. It is very important to highlight hypertension education in Missouri, since 9.7% of all deaths in 2020 had high blood pressure listed as either a primary or contributing cause of death. Worldwide, high blood pressure accounts for 12.8% of all deaths. And this is just 1 year, but Missouri resident hypertension and heart disease deaths statistically significantly increased in 2020 compared to 2019. And we will be watching for the 2021 data as soon as it is available. So with that, I'd like to turn this back over to Rochelle. Rochelle?
Thank you. Thank you, Chris, and thanks for highlighting the reason why we are doing this series year over year. So as a reminder, if you have control over what you view through this Zoom, you can slide the bar in the side-by-side mode to be able to see the slides larger on your screen. You certainly can adjust some of the settings for closed captioning, as well as how you are seeing things. I want to encourage everyone to join us in the chat. We do have a Q&A section of this webinar, as well as a chat box. If you would like to make the question or comment known to all panelists and attendees, be sure to adjust the to section to have all panelists and all attendees listed. Well, with that, I'm excited to introduce my colleagues at the National Hypertension Control Initiative, or NHCI. They're going to join us today and share just some highlights about the initiative nationwide, as well as many other data elements and quality improvement elements that go along with the initiative. So first, I'd like to introduce Phil Jupoco. Phil is a Senior Public Health Program Manager for the American Heart Association's National Hypertension Control Initiative, and he's been with our organization for over 20 years. He's based in Chicago, and he's led several health strategy efforts throughout the country, including successes with clean indoor air, tobacco and public health, and access to defibrillation. Phil has completed the All-State Greater Good Foundation Nonprofit Leadership Fellowship in partnership with Northwestern University Kellogg School of Management Center for Nonprofit Management. The Greater Good program brings together a handful of emerging nonprofit leaders from across the country to engage in unique leadership development program designed to transform their organizations, their communities, and the nonprofit sector as a whole. This opportunity has helped Phil serve as a founding member and immediate past president for the American Heart Association's H3 Club Employee Resource Group, which focuses on Asian Americans, Native Hawaiian, Pacific Islander, and South Asian staff and allies. I've had the privilege of working with Phil my entire tenure at the American Heart Association, so welcome to you, Phil.
Thank you, Rochelle. Hello, everybody. Great to see you. Thank you for having me and the National Hypertension Control Team go ahead and start up. So, team, we're going to go ahead and kind of kick us off and really jump into the NHCI. I hope some of you have heard of it, but for those who haven't, we'll kind of dive into it and kind of share what we're taking a look at when we take a look at hypertension as well. So we'll go ahead and get that next slide, David, and take it from there. Today's agenda, we'll be looking at the AHA and the NHCI overview. And then I'm going to hand it over to my team members, Celicia and David, to talk about hypertension, cardiovascular disease. We'll talk about SMBP toolkits, and then we'll have a chance to kind of answer some of the questions you have regarding either the NHCI, things about the American Heart Association, or blood pressure. So, David, let's keep it going. All right, everybody. So at the American Heart Association, our jobs can be easy to define. We save and improve lives every day. Our mission statement makes it that clear, but there's a lot more to it. Everything we do is grounded in our guiding values. How we do our work as a catalyst to maximize health impact is defined in our strategic proposition. All of the work that we're doing is dedicated to the 2024 impact goal, which was strategically developed and based on the latest science and data. It says that every person deserves an opportunity for a full and healthy life. And as a champion for health equity by 2024, the American Heart Association will advance cardiovascular health for all, including identifying and removing barriers to healthcare access and quality. So you can see that on our screen that's there that talks about what the AHA will be moving, and you'll see that the 2024 goal even has a sharper focus on health equity. So I know today we're talking about hypertension, but we can't go without hypertension without talking about health equity. When we talk about health equity, here's what we mean. Simply put, health equity is a state that would be achieved if all people had the just opportunity to be healthy. So I just kind of want to share that a little bit about where we stand. So let's talk about the NHCI. The National Hypertension Control Initiative is a 3-year funded demonstration project that focuses on improving hypertension control rates. The applications were due, I think, at the end of 2020, and we kicked off the NHCI in 2021. So under a cooperative agreement with the Office of Minority Health and HRSA, the Health Resource and Service Administration, the American Heart Association is leading technical assistance for 350 out of the 496 participating HRSA-funded health centers across the country. And folks, that's 350 health centers over 47 states. So there's a lot of road for us to be able to cover. As we take a look at the goal for the NHCI, the 3-year goal is to improve blood pressure control rates to 80%. And I know that's tough, but we're really working together, and we'll talk about all the different aspects to get to that 80% in that 350 health centers. The NHCI has 4 overarching strategies that we will execute over that 3-year project. Public education, community outreach, healthcare organizations, and project management. And let me dive into them to kind of share a little bit of what they are. When we take a look at public education, we're doing a lot of education for our patients, right? So we've already launched a national co-branded public service announcement focused on blood pressure awareness and education in both English and in Spanish. We're also doing some revamping to our websites, the NHCI websites, so people could get access to the information they need related to hypertension there as well. And we're also developing messaging to the communities regarding risk and self-monitoring techniques. So we're working on some of those, and as we work with the 350 health centers across the country, we're working with them on the language and the needs that their community has. As we take a look at community outreach, we're looking to recruit and engage community partners to promote the importance of blood pressure management, key signs and risk factors. So we're excited about this, and we've already confirmed 7 national community-based organizations that will be displaying and sharing that are partners with us in doing this key education community outreach that we'll be doing. Together, we'll be developing culturally and linguistically appropriate resources and training and education for these community-based organizations, as well as referral to local health centers. As we take a look at the healthcare organizations and our clinician team, You already heard me talk about the 350 health centers, and we're providing technical assistance through my team members, which I'll introduce in a little bit, as well as public health program managers that are throughout the country. Their job is to provide assistance to improve hypertension control rates through different opportunities like Target BP and other sources that we have. We'll support healthcare providers with training and build strategies to embed blood pressure monitoring and treatment and best practices for our health centers. And obviously we want to manage and evaluate what we're able to do. So we're designing a data-driven evaluation tool to help with the data gathering for all of our partners as well. We're also focusing on MAP and moving forward. So excited to take a look at our 4 pillars. We're rolling them out a little bit at a time, but I want to say, I hope we keep an ear open for that clinical piece, because that has gone full on blast since 2021. Just want to show everybody just kind of the participating health centers by state. Our team over here in Missouri, we've got representation in Missouri, but just take a look at all of the health centers that we're able to see, especially in the Midwest, where we're really focusing. I'm really proud of being in Chicago, how us in Missouri and Indiana and Ohio and Michigan, we're really all banding together to really focus on blood pressures. Just wanted to show that availability for everybody on the webinar. Next slide. As we take a look at the 2021 curriculum, we'll talk about 2022 in a second, you'll see the amount of topics and clinical webinars that we've hosted and shared with the 350 health centers throughout 2021. This is an incredible pace of what we've been able to do. These are recorded for the NHCI funded health centers, and we're really, really proud to be able to present them and have that relationship with them. Not only do we work with them on the training via webinar, but again, we're meeting them where they're at. We're going to the health centers across the country now. We're transitioning from virtual to in-person meetings to be able to kind of listen and hear and provide support for our health centers as well. As we take a look at some of the needs that we have, you can see here the requirements that we're focusing on. They're all important, but I think one of the big ones in every health center is at a different place. Every health center has a different electronic health record. Every health center has maybe a different device. So we're working with all 350 health centers to cater to what they need. I'll probably say out of all of the requirements, the one that's been the toughest on the early going is ensuring the support and use of the Bluetooth or wireless enabled SMBP device. Maybe in the chat, if you can share, have you had success with your blood pressure program talking about EHR integration and device integration, or have you had some roadblocks like most of our health centers? If you have any ideas, put that in the chats, and we'll kind of continue on to take a look at some of our accomplishments that we've had. So we've been really, really proud of what we've done just a couple months ago in 2021. When we take a look at patient education, we've developed an outreach messaging to communities regarding risks and blood pressure monitoring. So that's exciting. We've provided information on techniques and practices on how to do. We focus in on success stories of our health centers that have been able to educate their patients and work with their clinical team to get everybody up to speed. We've had an exciting get down with your blood pressure public service announcements. I hope this team has been able to see it. We have it both in English and in Spanish as well. So we're excited to have that. But we've also provided resources guides such as a start guide, a measured accurately training and information graphics. So we've been able to really kind of focus and share those opportunities. In our community, we work with great community-based organizations. You heard me already say, we've essentially secured 7 national community-based organizations. We'll make that announcement soon. That'll be working with the NHCI on raising awareness on the community. So we're excited to do that. We've hosted primary care association webinars focusing on the NHCI back in June, back in September, and also back in December. So we're providing that with our PCAs. I'm happy to really be providing that as well. And then what I'm really proud of is the 20 online educational events from March to December. That's 20 online events for our health centers to get on board and again, participate in those webinars. Outstanding work. As we take a look at more accomplishments, we want to take a look at different ways we can really support our MAP training that we've been able to take a look at. So overall, very, very proud of working with our health centers. They've taken on board, they've been honest and genuine about where they want to go, how we can get things improved. But that relationship is very, very key in order for us to hit that 80% goal moving forward. So David, as we take a look at our next screen, I just want to share, I'm very excited that in addition to myself being over co-leading the NHCI program team for half of the country, we have somebody who we brought on board here that'll be representing Missouri. Her name is Kennedy Colby. Kennedy's based out of Arkansas, and you can see all of the different states that Kennedy is responsible for. But with our NHCI sites and working with Rochelle and the team over in Missouri, Kennedy will be our face. So you just take a look at both of us if you need support regarding NHCI, hypertension as a whole, and the American Heart Association team will be here for you as well. So with that being said, I want to introduce Celicia Cardoso. And Celicia is one of our quality initiatives program manager. But Celicia, let me hand it over because we've got more exciting things that are going on that we probably want to dive into regarding hypertension.
Thank you, Phil. Hello, everyone. My name is Celicia Cardoso. It's a pleasure to be here from Dallas, Texas. And on the next slide, in 2020, you can see that the leading causes of death is heart disease, and also stroke made the list. There were a lot of different things that happened in 2020, whether it happened to your family, your friends, the areas in which you work at. Everyone was affected during those times. So as an organization, we were able to start working on how we can help equip others and provide resources to different health centers and community-based organizations. So this is just the UDS. So you can see how the ranges have evolved over the years. In 2020, 57.98%. So hypertension is the leading risk factor for CVD and stroke and CV mortality, the second leading risk factor for MI. So we know that this is definitely affecting either us directly or the communities in which we work with. And Black people do have higher percentage of chances, but we know that nearly a half of all American adults have hypertension, and many of them do not know that they have it. So this is what we've been doing as an organization, as Phil alluded to. We've been very busy making sure we're equipping others with the tools that they need. So the year one, we had the core curriculum, going into the webinars, the workshops, the office hours, the ad hoc one-on-ones, providing those for our health centers so that they're able to ask those questions that they have. And so we're able to equip them with the resources that they need. And year two is just where we're at right now. More webinars and workshops. We even had more technical and training assistance per everyone's request. And I'll talk a little bit more about that on the next slide, but we do have the SMBP learning forums as well. So this is just a brief look on how we've been doing. So as you can see, quarter one, we had the kickoff webinar. We had a lot of different events. We incorporated technical and training assistance through Unity Health, which gives you more of an in-depth know your EHR, program's potential, in-depth knowledge about how we can help you in the more technology ways. We flipped a couple things in our schedule, but we're still providing great content. And we even have individualized per your EHR training to help support the different things that you're experiencing in the health centers. On the next slide, just more of a look on the quarter three, quarter four. So planning is definitely important, especially looking into the information that we're receiving from our health centers. Planning accordingly, making sure we have the right people at the right place for producing the materials that are highly requested. And I think we mentioned about the resource guide and different resources that we have as a team that we're providing to our health centers. And MAP. So you'll hear this very often, but measure accurately, act rapidly, partner with patients. Those are three fundamental areas that we are addressing through the MAP framework. So we really encourage that people are looking and even just memorizing MAP, just measuring accurately, making sure that we are ruling out any white mass hypertension, act rapidly, let's see what's the best treatment for these patients, and partnering with them, making sure that they have a say on their healthcare, but partnering with them and making sure we're addressing the different areas and making sure that we help improve those outcomes. So the benefits of SMBP, this is just a high level information, but just making sure we're masking out that white coat hypertension. So are they going into the clinic and every single time they come in, are they scoring higher numbers? And whereas if they're going from home in the comfort of their home, more relaxed, do they actually have hypertension? And then better manage the patient's blood pressure. So making them actually be able to take their medication. If there's any treatment protocol, we'll make sure that they have that, making sure they have all the tools that they need to help them during their journey, and then help patients adhere to treatment. So if there's any needs that we can help them equip them with, we will do that during the SMBP journey as well. And best practice. So there is a lot of evidence based on the 2017 ACC on what the actual impact of SMBP. So you'll hear target BP, you'll hear just the joint correlation between AMA and AHA approving the SMBP and the best practices that we see for the diagnosis in the out of office, and the overarching strategies on how we can impact these patients both in and out of the office. And I'll go ahead and send this to my colleague, David Pena. He's been with the organization for a while now and has made a very high impact with our team. Thank you so much.
Celicia, thank you very much. Again, my name is David Pena, Quality Improvement Program Manager with National Hypertension Control Initiative. Before this, background in cardiopulmonary rehab and quality improvement in both outpatient and inpatient settings. Thank you very much again, Celicia. Today, I'll be giving an overview on an implementation toolkit by Million Hearts, which aims to help organizations successfully implement self-measured blood pressure, which I'll abbreviate to SMBP, into their practices moving forward. Today, like I said, just kind of taking a deeper dive into the Million Hearts toolkit. The purpose of the Million Hearts Toolkit, SMBP Toolkit, is to help organizations implement SMBP successfully into their care processes and workflows. It provides step-by-step instructions going through goals, program design, role designations, and important other areas to consider when taking on SMBP into a new program. So, a successful plan of implementation always accompanies goals. It's important to recognize that not all organizations will have the same goals, and nor will those organizations serve the same populations. Aligning program goals with those priority populations and establishing how you're going to achieve those goals are imperative. Some examples of priority populations that you all might serve are listed here, such as uncontrolled hypertension patients in clinic, newly diagnosed patients, patients not adhering with medication regimens, and so on. So when undertaking the intricacies of building an SMBP program, there are device considerations that would encourage you to build into your policy and procedures regarding device procurement. If you were planning on loaning out SMBP devices as an option, what does that look like? How many devices will be purchased, and how are those devices going to be stored, cleaned, and then tracked? On the next slide, we'll talk a little bit about device procurement. So on a note, the AMA convened experts with relevant technical and clinical practice expertise to develop the VDL criteria to aid in determining which SMBP measurement devices in the United States have been validated for clinical accuracy. Tying this back into the science Celicia touched on, if we can't be confident with the measurement a device is displaying, that impedes the clinical decision-making process. So please visit validatebp.org, which is regularly updated with validated devices for clinical accuracy. Back to program design. So other program design considerations include staffing roles. Who is coordinating the process? Who is training the patients? Who is outreaching to new potential patients? Who is managing that data and then analyzing that data? And then who's training the trainer? who's making sure the staff are appropriately trained to have the competence to then relay that information to the patient. All important considerations. So what does the identification process look like for identifying the new patients? How is the patient training being conducted? What room is it being conducted in? The step-by-step guide here on the toolkit will walk you through all these considerations and help you plug in some of those puzzle pieces and making sure that you're not missing out on any of the important factors of implementing a new SMBP program. Additionally, what other resources are being provided to patients regarding blood pressure, SMBP, those resources, clearly define that in your workflows. And then on team member roles, real quick, it's just important to touch on those roles within the program, including the licensed physician or clinician and the support staff. Hint here, back to the MAP framework, that the patient has an important role to play in this continuum as well. They have to be the one that's checking their blood pressure at home. They have to be the one that's then communicating back with the office and engaging them and empowering them in their role in controlling their blood pressure is important. And that team-based care approach is integral. Back to the duration of the device use, which we briefly spoke on, I wanted to come back to the clinical purposes of SMBP that we covered earlier. During diagnosis, during treatment intensification, so increasing someone's meds or giving them a new hypertension medication, and ongoing management. This is important to revisit when considering that clinical purpose of the device use. So this illustration just shows the measurement required for the diagnosis period. You'll see in the parentheses that signifies the day, 2 measurements in the morning, 2 measurements in the evening, at least 1 minute apart for 3 to 7 days, ideally consecutive, giving you roughly the 12 to 28 total readings, averaging out those readings to then make a clinical decision on the patient's blood pressure. Real briefly here, National Association of Community Health Centers also provides excellent resources. Wanted to point everyone to this. This is choosing a home blood pressure monitor for your practice at a glance. Lots of things here, including, is the device Bluetooth enabled? Does it allow for in-device averaging of those readings? How much memory space does it have? How many users, if you have a multiple family household that maybe has several hypertensive patients, can they share a device? What cuffing sizes are available? And if it's on the validated device listing, and how much does it cost? That all important considerations to take into consideration when purchasing these SMBP devices that you're going to be utilizing with the management of your hypertension patient population. Just pointing out this resource. And then on that point of reimbursement, another resource here provided by the National Association of Community Health Centers is regarding reimbursement tips. So requirements for RPM and SMBP. This was last updated in September, but just wanted to cover this. Under the public health emergency, this tool identifies program requirements, the patient eligibility and the consent required, the time frame and services, authorized provider required, and the staff, documentation, coding, billing. This goes more in depth, but please visit the PDF for further details in regarding to how you can get some reimbursement for some of the SMBP services that your organizations can provide. And lastly, if you want to learn more about what's going on with NHCI, and at this time, I'm even going to address one of the questions we got in the chat regarding, are non-funded health centers able to participate in the healthcare provider training support opportunities? Wanted to take this time to point that question to our website. Not all of our training and technical assistance events are available to the public or other health centers, specifically to the NHCI group, but we do have a selected amount of webinars that are available, and you can find them at our website. And on the website, you'll continually find those newly added, updated webinars and also other resources. So I encourage anyone, if they need any more resources or want to see what actual content NHCI has provided, please visit our website. And I think this is now where I'll kick us over to the Q&A section, where hopefully me and Phil and Celicia can take more questions. But please, anyone with any questions, please post them in the Q&A and we can lift them up.
David, thank you very much. This is Phil again, and I kind of want to ask and share this as well. David, Celicia, and I have been looking across Missouri, across Illinois, across the Midwest and the country of that electronic medical record and device integration. Would love to read out, because I think this is important for a lot of our health centers. Where are the pain points that we're seeing? I think that's strong. Again, sometimes it's the integration. Sometimes it's the opportunity to train the patients as far as using the apps. Sometimes it's the device themselves. They'll have their cell phones, and the integration requires one, maybe two, maybe three apps to be able to all talk together. And then it's obviously trying to make sure that we have patient compliance as well. We've seen some areas where people say that they've had some problems with acquiring blood pressure cuffs, the actual device. Again, in the chat, if you've experienced that, if you've tried to get some blood pressure cuffs from the major manufacturers out there, love to see in the chat if there's been any roadblocks in actually getting the devices when dollars are available. So let me take a little bit of a pause. Let me see if anybody has any thoughts of that, because I think this is all important as we take a look at the NHCI health centers in Missouri and beyond. Those will be the hard questions I think we'll be asking to them. So there's a lot of different levels that we take a look at. David and team, Celicia, I want to also kind of share this in the big picture as a whole. When we take a look at the NHCI, 80% of the 350 health centers, for the most part, are in some type of pilot mode, right? So they think they're getting close to getting the devices that they want, but they're still kind of validating and making sure they do that. They're trying to have a strategy to bring up and recruit individuals. So I think that's part of the plan. They're trying to figure out how to train their own healthcare team members on hypertension guidelines and protocols. So I think that's part of it as well. And then you have the normal, once again, day-to-day compliance with eventually getting to the patient. So David, do we have anything in the chat? I think I see another Q&A, but let me take a pause. I've got a couple of other things I want to bring up. But David and Celicia, what do you guys see in the chat, or anything we want to kind of discuss really quick that's going on?
Yes, we have a question from Kelly Steinhoff. Hope I'm pronouncing that correctly. Are you able to speak to the importance and impact of pharmacists in a team-based model to support these efforts?
Thank you very much, Kelly. Team will all jump in as well. I think as we take a look at partners, you've heard us talk about our community-based organizations. You've heard me talk about our primary care associations. Well, I think pharmacists play a strategic role. I think what we've got to try to figure out is how do we do this either on a statewide basis or in a market? Because if you remember the map that we showed, it may not show, it just showed the number of health centers in the states, and we see a wide range. Many are in urban areas, but we have a lot of rural opportunities. So when we find an opportunity to build strategic relationships with pharmacists, I think we're going to go ahead and take that opportunity and find and pilot maybe a model in maybe a key location, and then assess if there's other partners we could use to continue that momentum that we have with blood pressures. But without a doubt, pharmacists are definitely a great key to have. We've just got to figure out the tool to be able to do that. And that's where our team members like Rochelle and other American Heart Association's community impact directors who are building those relationships, not only this year, but many years and many decades, they've built those relationships with partners across the countries like pharmacists. So that's how we work together to try to strengthen that bond. David, Celicia, any additional thoughts or other comments in the chat?
Yeah, absolutely, Phil. On the point of the pharmacist's role in SMBP, we had an excellent contribution here in the chat that Target BP, which actually helped create the MAP framework, is going to be hosting a BP pharmacist roundtable. So you could see that link here posted in the chat. So really great to have that here posted in the chat. But I think we got another question from the chat, and hopefully Celicia can provide us a little bit of insight. Just speaking on the role of a CHW in SMBP program.
Yes, so I am a community health worker and also a community health worker instructor. But what I've been seeing in the health centers is that the community health worker has a very important role. They're able to identify different things that the patients may be facing, as well as the SDOH, the social determinants of health. They're able to identify those things that maybe we do not see from the different conversations that we're having with those patients. And sometimes, after finding out that you have hypertension, being able to maintain, listen to the doctor explaining what to do, they see that barrier because they're looking at, oh, now I have hypertension, and they're not able to understand what needs to be done. So the CHW goes into the room, they have that rapport with the patient, they're able to follow up with those patients and help make sure that they're able to navigate throughout the system, as well as bring any concerns to the providers as well. So they do have a very fundamental role within the SMBP journey as well.
Celicia, I appreciate that as well. When I talk to our health centers throughout the country, our CHWs helping on with that onboarding process of those devices or helping with the apps, getting them on the phones, showing those patients how to use that. So play a critical role. And we're very excited and proud to see that we see CHWs have a role in not all, but many of the 350 NHCI health centers that we're working with. So that's a thumbs up. Well, care coordinators, CHWs, we see that combination there, and they play a critical role as well. David, what else? We got a couple questions. I know somebody wanted to take a look at also some slides as well. So we'll take a look at this, but let's continue fielding some questions because we've got a couple opportunity as well going as well. And team, we might also have a special guest, but David, let's continue diving in and we'll see what else we've got on the chat and or questions.
Absolutely, Phil. Yes, and I was hoping you can give us a little bit more insight, Phil, with your community organization work. So Leslie in the Q&A asks, how do we want nonprofit organizations to support this work we're doing with blood pressure control specifically?
Thank you, David. You heard me talk about the 7 large community-based organizations we're going to announce and share and start working with raising awareness of hypertension risks and consequences throughout the country. So you're going to see that as we're going to roll that out with our 7 CBOs. But really what we're really working with is maybe a couple different levels when it comes down to our community-based organizations / not-for-profit orgs. Really raising awareness. We're going to take a look at some of our faith-based organizations to take a look at what we can do in raising awareness of hypertension within that group. We're going to take a look also at some of our partners who may be holding an event or hosting it to take a look at something focused on hypertension, and that'll vary from not-for-profit from group to group as well. And then there's going to be some community-based organizations that, again, are taking a look at some different platforms. There's a few platforms out there, and one of them I'm thinking is called Unite Us. There's one of these navigation platforms to help connect individuals, and that might be a very key role that our not-for-profits might be able to utilize some of the free software that Unite Us has, and then connect them to the local or closest or appropriate health center to making sure that those blood pressure or hypertension issues just are not overlooked. So that might be a fantastic way. We'll say this, David or Celicia, if we get a chance, maybe we could put our NHCI address. I know we had it on the slide, but just in case anybody has additional questions they want to connect with us on, we'll be able to kind of take a look and do that as well. But yeah, thank you very much. We'll bring up that slide, everybody. We're going to continue asking some questions, but we want to be able to make sure that if you need to get a hold of us, you see here our websites that we have. I think if you need to get a hold of us, it's nhci@heart.org, and we're able to respond and really kind of collaborate and kind of work and continue providing more additional information. David, I think somebody also wanted to see the contact slide. Is that correct?
Yes. I have that from Jennifer. We could bounce back over to the team member role slide that we were talking about in the toolkit. But I think just prior to that, we are fortunate to have a program director from Target BP on the call that wanted to give a little bit more insight into the workings of the pharmacist and the role in SMBP and hypertension control, as she's a subject matter expert. So I'd like to open up the floor to Allison Smith to give us a little bit more insight.
Thank you so much, team. I really appreciate joining in this great event that you all planned. I was offering an invitation to join a pharmacist roundtable, as you mentioned earlier, and I dropped the link in the chat, but we really intend to explore some of the really important roles that pharmacists can play in delivering care. As partners with care teams, they can play a tremendous role in training patients how to use SMBP, monitoring their measurements, and providing a collaborative approach to treatment intensification. We're so excited through the NHCI work to leverage technology to connect patients to care. And the key word there is connect, because it's not the device that controls blood pressure. It's the relaying of that information to care teams and using that information for the diagnosis of hypertension, the intensification of treatment to get to goal, and sometimes it's used in long-term monitoring to support lifestyle change. So there's a lot of excitement over the devices and the technology. We just have to make sure it's integrated into clinical care. I'm happy to take any other questions. Thank you all very much.
Thank you very much, Allison. And for Jennifer, I wanted to bounce back over to the team member role slide real quick. And I can just touch on this slide again. So important to identify these roles for the care continuum and making sure that the team-based care approach is utilized for optimal SMBP implementation. So identifying those roles, who's doing the device training with the patients, how are those devices getting calibrated, how are high measurements being relayed to providers, which staff members doing that, and which staff members providing lifestyle education. And then the licensed clinician's purpose in the care continuum, actually the diagnosis, prescribing or titrating hypertension medications, and defining that protocol for the care team, interpreting the readings, and then making those clinical care decisions, and then the support for the recommended lifestyle change and utilization of SMBP is integral for patients to adopt those care practices. But thank you very much, Jennifer. Hopefully I was able to touch on more of what you were hoping for. Don't want to spend too much time on this slide. Thank you very much.
David, I think I see, and team, if you have more questions, we want to get this back to Rochelle and team to see if there's any additional updates. But I would there is a question regarding our not-for-profits. How will they measure success or impact while supporting their work? I think that will really depend on the level of participation our organizations want to do. Nothing is wrong with sharing our information that the National Hypertension Control Initiative has through our social media platforms, some of our educational branded materials. That's one way, and we can measure it through that opportunity. There might be a bigger opportunity to take a look at those organizations that want to, again, host some type of events on hypertension or have something recurring. We'll work with them on measuring their success that way. And again, you may have heard me talk about our community-based organizations taking that bigger step and providing those referrals to those health centers as well. So depending on what level our health centers and our not-for-profits and community-based organizations want to get into, we'll work with them to kind of assess their impact in this bigger NHCI effort. David, any additional questions or thoughts that we're seeing?
I think if you just address the follow-up question by Leslie, that's all we have in the chat.
Okay.
Yeah, I think we do not have any open questions at this time. So back to you, Phil.
All right, everybody. Well, again, thank you for joining us and discussing the National Hypertension Control Initiative. We've got a dedicated team, and we echo and continue the relentless force that the American Heart Association really focuses on. This team is comprised of outstanding members that focus on our communications. David, Celicia, and Allison and team members take a look at our quality and clinical side of the house. We take a look at my team that I co-lead, and we take a look at the programmatic opportunities that we're having. And we are excited to have our evaluation team really kind of putting this all together to tell us a story about hypertension, locations, and really helping individuals live longer as well. So I want to see if there's anything else. Rochelle, is this being recorded? I'm going to hand this back to you. There's a couple one as well. Yeah, just trying to see if there's anything else, Rochelle. But team, thank you so much. We look forward to answering any questions. Rochelle can always get a hold of us as well. But for those of you in Missouri, thank you very much. And for those of us beyond, please let us know if there's anything we can do, because more than likely the NHCI is having activities in your state.
Thank you, Phil. Thank you, Celicia and David. Really appreciate this very informative overview and the discussion. And thank you for everyone for joining in the Q&A and the chat. And just to expand on what Phil had offered up as far as your American Heart Association staff in your area, your region, your state, reach out to us. So where we highlighted today, where the technical assistance through the NHCI collaboration and initiative is dedicated to a cohort of clinics. Those extended learning and those topics can also be in collaboration with your American Heart Association staff. I would love to work with community-based organizations and other nonprofits on some very specific local and regional work. So that invitation is always open. And at the state level, Chris and Marianne and I have talked about, state level support to many other nonprofits, other state-based organizations, other community health centers. So just consider this an open invitation. The American Heart Association is dedicated to extending people's lives, and hypertension control is a significant element of that. And we are steadfast in our mission to get hypertension under control in our communities, in our states, and nationwide. So with that, I just want to again thank our special guests today in joining us. And I really do appreciate a great conversation. Point of just clarification, this event is being recorded, as have all of these webinar series. The links to those recordings will go out later today, or excuse me, later this week, so that you can use them and refer back to them in the coming weeks, months, years. I wanted to also take this opportunity, since this is our last webinar. I want to thank my collaborative partners in the Missouri Department of Health and Senior Services and the Health Quality Innovation Network. Chris, I know you had a few comments to close this out here. I'll turn the mic over to you.
Thank you very much, Rochelle. And wow, thank you for a great closeout to our Innovations in Hypertension Control series. I hope you have all benefited from your participation in the Lunch and Learn series. And if you're sitting there with additional questions about any of the content on any of the 3 Lunch and Learns, please contact us. Reach out to Rochelle or myself or Marianne Kimball. And during the course of the year, if you have ideas about topics for next year, Lunch and Learns, please don't hesitate to reach out to us, because we'd like to receive input, and we would like to organize a planning effort to make that possible. So thank you all for participating in the Lunch and Learns, and just hope that you have a great afternoon today. Thank you once again.
Thank you, Chris. And again, I really appreciate your collaboration in bringing this series to our community partners. So with that, we are closing out our series, and we are inviting you to join us in sharing the message of hypertension control and helping individuals understand how they have the power in their own health. And so today I'm going to close out this series with a video of from the American Heart Association called Get Down Your Pressure. And so when the video closes, this webinar will also end. So with that, I wish you well. I hope you have a great rest of your week, and stay tuned and join us for future events like this. So with that, here's our video.
Get it, slip it, cuff it, check it. Talk to doctor now and share it. Get it, slip it, cuff it, check it. Talk to doctor now and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it. Gonna get it, gonna slip it, gonna cuff it. Check it, talk to doctor and share it.
Get it, slip it, cuff it, check it. High blood pressure silently affects millions of Americans. Staying on top of your blood pressure is as simple as these 4 easy steps. Self-monitoring is power. Visit manageyourbp.org to learn more.
Thank you again, everyone. Have a great day.